This time on Healthy Body, Healthy Mind. What if your dream of starting a family was in jeopardy? Many couples trying to become pregnant face issues they never imagined could happen to them.
It was about a year before we decided something's not right here. We need to go see what's going on.
We decided it was time to really get serious about thinking about a family. And we began to try, and we tried for some time before we realized something was wrong. It just wasn't happening.
We both went for a variety of tests, and really nobody could ever tell us anything specific that was wrong. Our diagnosis was unexplained infertility.
Infertility can be frustrating, mysterious, and difficult to accept. But with advances in reproductive medicines, many couples may eventually experience this dream finally coming true. Major funding for Healthy Body, Healthy Mind is provided by Sanofi Aventis. Throughout the world, every day, everywhere, working for what really matters, health. And by GlaxoSmithKline, improving the quality of human life by enabling people to do more, feel better, and live longer. Additional funding provided by Medtronic and by Serono and by Actelion Pharmaceuticals. Welcome to Healthy Body, Healthy Mind. I'm Carlos Pagan. The difficulties of conceiving a child are becoming more commonplace for many couples. According to the Centers for Disease Control and Prevention, infertility affects more than 6 million men and women in the United States. And though the reasons often vary, one thing that remains a contributing factor is that a woman's reproductive abilities begin to diminish as she ages. As the biological clock ticks away, fertility declines with age. For some couples, starting a family later in life can mean facing the obstacle of infertility. Ellen and Steve Kester live in the suburbs of Austin, Texas. They're two young professionals who met 14 years ago while studying Spanish in Mexico. 4 years later, they were married. Early in their relationship, they talked about having a family, but decided that they would wait until the time seemed right.
When we got married, we knew we weren't ready to have children then. We were both pursuing our educations and careers, and we keep a very busy pace.
We didn't make a conscious decision to have children later in life. We just made a conscious decision to live our lives and do things we wanted to do, such as our education. We traveled together before we really got serious about thinking about a family.
Ellen and Steve thought that starting a family while in their 30s would be okay.
Pregnancy is something that has to happen when a couple's ready for it. And so, there are no blanket recommendations. We can't say you should get pregnant before you're 35 or before you're 38. But what couples really do need to understand is they need to understand the information.
Through adolescence and early adulthood, women are often counseled in how to prevent pregnancy. But little mention is made on how to preserve fertility.
Can't overestimate the problem with age in that anything that delays the onset of attempting pregnancy will make it more difficult to get pregnant and again cut off the options that may be available if they were younger.
In essence, infertility is the body's inability to perform the basic function of reproduction.
Infertility is really a definition, and it's a definition that a couple has been attempting to get pregnant, not using contraception, for a year. And while that is often a well-used definition, and it's one that, for example, insurance companies may utilize, it's got some practical problems. if a woman is older, and if she were to wait a full year before she sought medical aid because she wanted to fulfill the full year before she can consider herself infertile, she would then slide down the slippery slope and be yet a year older, where now her chances have dropped off even further.
Women over age 35 have an estimated 50% chance of becoming pregnant naturally. Women who prolong first-time childbirth into their 40s decrease their chances even more to just under 15%. But infertility isn't just a female problem. Many couples are surprised to find out that there might be issues brought on by the male partner.
So it's a 50-50 proposition. One needs to have normal sperm, one needs to have normal eggs, and one needs to have normal fertilization.
Approximately 40% of infertility problems are due to the female, and 40% to the male. The remaining 20% is a combination of problems in both sexes, or the cause is unknown altogether. Understanding the facts is critical to help preserve and protect a couple's fertility. Controllable risks like smoking, drinking, excessive exercise, and being overweight are all things that couples who are trying to become pregnant should avoid. Doctors say that abstaining from these risks can help enhance their overall well-being and help foster a healthy reproductive system. Infertility may be the result of certain past medical conditions. Experts believe that illnesses, diseases, reproductive surgeries, and certain medications all can affect conception. For more information about infertility and many other health and wellness issues, visit our website at healthybodyhealthymind.com. The entire reproductive process is a complex system. The effort to maintain good health is only one small piece of the puzzle when trying to ensure fertility. Here's correspondent Wendy Rutledge to explain.
One of the wonders of reproduction is that even before a baby girl is born, she's already developing her supply of eggs that will last a lifetime. In fact, she will begin producing eggs as a tiny embryo in her mother's womb until the day she is born.
The greatest number of eggs a woman's body has is not when she reaches adulthood, but when she is still safely tucked inside her mother's womb, between 5 to 7 million to be exact. But that number changes the moment she is born. At Weill Cornell University in New York City, Dr. Zev Rosenwax is the director of the Center of Reproductive Medicine and Infertility Clinic.
At birth, she may have 1 million or 2. At puberty, she will have several 100,000. At age 37, perhaps 25,000.
In a healthy reproductive system, ovulation occurs where one of the ovaries produces an egg. The egg then develops in a small fluid-filled sac called the follicle. Once the egg is mature, it is released from the ovary and passed through one of the fallopian tubes, designed to catch the egg and move it into position to meet the sperm. It's here that the egg becomes fertilized, and the resulting embryo is transferred to the uterus where it grows. At the Texas Fertility Center in Austin, Texas, Dr. Kaylin Silverberg is the medical director.
So if one thing goes wrong, the cycle's over. So if you ovulate, but the egg is not picked up by the fallopian tube, nothing else matters. How frequently you have intercourse, whether your timing is right, whether your uterine lining is acceptable, nothing else matters because the egg was missed by the tube.
Dr. Edward Marute is the medical director of the Highland Park IVF Center, Fertility Centers of Illinois.
Because a woman needs to have a timely, regular ovulation, releasing an egg in order to get pregnant, the ovulation and failure of pregnancy is reflected by the menstrual period.
A regular menstrual cycle is key to a successful pregnancy. Also, in combination with a healthy egg, fertilization requires healthy sperm.
In the male, one must be sure that with the semen analysis, one at least assures that for a sperm to fertilize an egg, it must have normal shape, and it must have vigorous, spiral-like motion.
After a year of trying on their own, Ellen and Steve reached out to her obstetrician for help. They both went through a variety of tests. Their diagnosis was officially referred to as unexplained infertility.
So we never did get an answer as to why it wasn't working, but we knew that it wasn't working.
Needless to say, it was a difficult time for Ellen and Steve.
We're watching a lot of our friends get pregnant and a lot of family members get pregnant, and I just wanted to cry every time I heard it. And it was just so frustrating because it was like, why is it that these people get pregnant so easily and we can't? And we've been trying for so long.
Ellen is not alone. Most couples that are faced with infertility will experience extreme emotional highs and lows. But help is possible. Coming up, we'll learn what treatment therapies are guiding couples through this difficult time. Plus, we'll meet a couple that struggled for years, but eventually found the answer that helped them start their family.
While many couples have to deal with the frustrations of infertility, many others voluntarily choose to limit the size of their families. On average, women today are having 2 children with approximately 4 years' time between the births. The proportion of births to women in their 20s decreased from 62 to 53% between 1985 and 1994, while the proportion of births to women 30 to 44 years of age increased from 25 to 34%. Since the mid-1970s, there's been a 4-fold increase in the percentage of first births to women 30 years and older. Dr. Perry Kritschmar has more on the latest methods of early fertility monitoring for first-time parents in this Healthy Minute.
For couples who are trying to start a family, there are a number of at-home monitoring methods that can be used, like charting the dates of the menstrual cycle and tracking the basal body temperature, which are the ups and downs of the body's temperature before and after ovulation. For some couples, these resources can help, but doctors say these measures do not give all the specific information needed to assess more complex problems. Many things can affect the couple's fertility. If couples are having trouble conceiving and have tried at-home measuring methods, it may be time to seek the help of a reproductive endocrinologist. That's a Healthy Minute. I'm Dr. Perry Kritschmar.
What is the average cost of fertility treatment? Fertility treatment costs vary greatly depending on what insurance coverage a couple may have. Many insurers offer coverage for the various stages of infertility treatment. Experts say to better understand what the financial obligations might be, couples should know what their policy covers before seeking out a reproductive specialist. More women today are choosing to have children later in life than a decade ago, and many first-time parents in their 30s will conceive naturally. The probability of that happening without medical intervention, however, becomes more remote with each passing year. Once again, here's Wendy Rutledge.
While it is true, science has refined techniques to help infertile women become biological mothers, medicine often has its limits. Age can often create a seemingly irreversible barrier.
In Highland Park, a suburb of Chicago, Kelly and Tom Sherwin make their home. They met in college, and it didn't take long for them to find out they were perfect for each other.
And since then, I don't think we spent more than a couple days apart. And that was 12 years ago now?
They eventually married, and shortly afterward began talking about starting a family.
Since we got back from our honeymoon, we kind of just said, let's just let what happens happen. And that's what we've done. So, and that was 8 years ago.
Kelly is currently an art history professor at Oakton Community College in Illinois. By age 32, she had achieved most of her goals, a successful marriage and career. What she was missing were children.
It just all of a sudden one day dawned on me, wait a minute, we haven't been doing anything to stop this, but nothing's happening. So it was about then that I went to the doctor.
In many cases, an obstetrician-gynecologist can work with couples who are having difficulty becoming pregnant and help them resolve their problems.
If they find certain problems, or if the initial test proved to be too complicated, they are then looking to refer them to a reproductive endocrinologist. If a woman has difficulties with normal ovulation, or sometimes simply in order to increase the odds of getting pregnant, the reproductive endocrinologist will use fertility drugs to stimulate the ovaries.
So if a woman does not ovulate regularly, we'll start her off on pills that are relatively inexpensive and very effective. 80% of women who don't ovulate will ovulate with the right dose of pills. If they don't work, we then proceed on to the injectable fertility drugs. And there's been so many advances in the past 10, 15 years with the injectable fertility drugs. The safety factor has gone up astronomically.
After almost a year, Kelly and Tom sought the help of a reproductive endocrinologist. Together, they discussed different therapies, and in combination with fertility medications, tried an intrauterine insemination, or IUI.
A process where the husband's sperm is processed within the office and resuspended in a small amount of a nutrient solution put directly into the woman's uterus. Why? Because this bypasses the cervix so that more of the better sperm get into the uterus, and it may actually improve a mild or moderate problem with the sperm.
After about 5 of those, still nothing was happening. So we went to step 2. Step 2 was to start the IVF.
In vitro fertilization has changed everything. It used to be a treatment for one type of person, one type of couple, and that was a woman who had a blocked fallopian tube. So if there was no way for the sperm and the egg to get together, the theory was you take the eggs out of the woman, you fertilize them in the laboratory with the man's sperm, you put the embryos back in.
At the Texas Fertility Center in Austin, Kathy Reynolds is the IVF coordinator. She says that one of the results of IVF is the possibility of multiple births, but that's changing as embryologists are refining these techniques.
With IVF, we can control the number of embryos that we transfer, so therefore you don't get the higher rate multiples like you do in an IUI cycle. By growing the embryos to day 5, it allows us to put in fewer embryos because we have a better idea of what that embryo is going to be doing. At day 3, you have about 8 cells. On day 5, you have about 100 cells. That lowers the risk for multiples to almost nothing.
The IVF procedures account for about 99% of all assisted reproductive technology, but success rates vary. In general, though, about 35% of couples nationwide achieve pregnancy. Male patients with poor semen quality were often denied admission into IVF programs, but that was before the advent of a procedure called micromanipulation intracytoplasmic sperm injection, or ICSI.
There, a single sperm is picked up under the microscope. The egg is identified, isolated, also under the microscope. A microneedle picks up the sperm, and the sperm is injected directly into the egg to permit fertilization to take place. ICSI is the single greatest revolutionary procedure in fertility treatment since the introduction of IVF itself.
Ellen and Steve Kester tried several treatments with no success. But then, after a lengthy and emotional roller coaster ride, they opted for IVF.
In terms of a time commitment, it's huge. In terms of a financial commitment, it's huge. And beyond that, it's very emotionally intense too.
It would be a decision that would change their lives forever.
Catherine arrived 2 weeks early, rushed off to the hospital, and 2 hours later we had a little girl in our hands. It was so amazing. I just couldn't take my eyes off of her.
It's great. Being a dad is the most wonderful thing in the world. That's probably one of the greatest things about the fact that this treatment is available. This technology makes it possible for people who may not have been able to be a father and a mother to be a father and a mother.
After 2 extremely disappointing IVF cycles, Kelly and Tom decided to try one last time. In combination with the latest technique called pre-implantation genetic diagnosis, PGD, and IVF, Kelly remembers the phone call she received while out shopping.
I sat down on a display, which I don't think you're supposed to sit on, and I just started crying, and everybody was looking at me. Are you okay? I said, yeah, I'm okay. I'm not going to tell everybody in the genes department what's going on.
It's been a long, emotional road for Kelly and Tom, and as they prepare for their new arrival, they are extremely grateful that they got a chance to fulfill their dream.
When you start going through this process, you do realize, wow, it is pretty amazing. I said to my husband probably every week, I can't believe anybody in the world ever gets pregnant, period. Because there is just so much that has to happen. It's not as easy as you think.
Both couples, Ellen and Steve, and Kelly and Tom, say this experience wasn't easy. They agree that actively staying informed by seeking as much information as possible helped them through this difficult but rewarding time.
As Wendy mentioned a moment ago, a procedure called a pre-implantation genetic diagnosis, or PGD, played an important role in helping Kelly and Tom become pregnant. Doctors use PGD to discover genetic abnormalities in embryos before those embryos are implanted in the mother. In its infancy is the use of pre-implantation genetic diagnosis, where the ability of an embryologist to select an embryo simply on the basis of microscopic appearance and the developmental quality has now been even further added to by the ability to eliminate embryos that have severe chromosomal abnormalities that would result in no pregnancy or a damaged embryo that would miscarry.
2 embryos were healthy enough for Kelly and Tom.
We picked the name Liam because Liam means warrior. And we thought out of all of those eggs, he's the one that said, this is my territory.
Ellen and Steve want a large family. After much discussion and another IVF cycle at the age of 36, they're preparing for yet another surprise.
We went in last week for a sonogram, and we learned that we're having a boy and a girl.
I don't think Catherine really knows what's coming yet. She's the center of our universe, and she's been accustomed to being the queen of the household, so there'll be a little bit of an adjustment, no doubt, when the twins come.
How fertile any one couple may be is a complicated equation, with genetics, physiology, lifestyle, environment, and age all playing a role. And though doctors will examine all male and female fertility issues, unfortunately, not all couples will be able to conceive despite the best medical science has to offer. Still, experienced fertility counseling may be a couple's best chance for success. Well, that's it for this edition of Healthy Body, Healthy Mind. I'm Carlos Pagan. See you next time. For more information about infertility and many other health and wellness issues, visit our website at healthybodyhealthymind.com. And to answer any specific questions you might have about infertility, be sure to contact your healthcare provider. To comment on today's program, call 888-380-6786.
6500 or email hbhm@itvIsus.com or visit our website at healthybodyhealthymind.com.
Major funding for Healthy Body, Healthy Mind is provided by Sanofi Aventis. Throughout the world, every day, everywhere, working for what really matters, health. And by GlaxoSmithKline, improving the quality of human life by enabling people to do more, feel better, and live longer. Additional funding provided by Medtronic and by Serono and by Actelion Pharmaceuticals.